All right, so this is the childbearing education workshop, and today we're going to talk about chapter 1 and 2. So, a little bit about me. My name is Ellen. I was born and raised in Charlotte, North Carolina. Well, I was born and raised in Greenville, but I grew up in Charlotte, and I've lived in LA since 2018. When I started writing this workbook in 2020, I was put in a situation where I had a whole lot of time on my hands. And I was like, what can I do to support families and provide them with some level of emotional support, but also like things that they can start to work through the emotional, work through understanding their body, work through having the space and opportunity to see something delivered in an evidence based, understanding type of way. So, one of my first experiences with midwifery and with doula care and just birth work in general was with one of my friends from high school named Tashira. And that was one of my first clients right out of doula work, right out of getting my certification. And she ended up passing with an aneurysm 3 months after she had delivered her baby. So whenever I come into this work, I know that a lot of anxiety, a lot of fear, a lot of this the social things that we hear, the reasons why Black women have such lower rates of surviving through pregnancy, their babies. So just understanding that and having her in my heart and in my mind at all times. This book in particular was dedicated and is dedicated to her. So anytime that you see me or hear from me, if we get the opportunity to chat with each other further, just know that this is as thoughtful of a workbook that I could put together for you as birthing people and anybody who's supporting you. So this is for moms, this is for dads, this is for aunties, this is for your doula, this is for your cousin, whoever is going to be there to uplift you as you bring life into this world. So, quick little legal disclosure. The information in this publication is not to be used or construed as medical advice. It is not intended to replace the care of a licensed healthcare provider. The information shared in this publication is created to inform families and birthing people about common knowledge regarding pregnancy, hormones, labor, delivery, and postpartum healing. All information that was not written by me has been credited. The publisher, the author, illustrator, editor, and my business, Simply Ellen Holistic Services, is not liable for any loss, damage, or injury incurred directly or indirectly as a result of any information shared in this publication. That's just the CYA page. So we're going to keep it pushing. So today, hormones in pregnancy and physiology of pregnancy. Those are the two things that we're going to chat about. And I'm going to share more information, and there will be opportunities for us to dialogue with one another throughout each portion so that we can answer some questions, some myths, and then also be able to provide you with some things that you can walk away with and be like, okay, I feel more confident. So let's get into one, hormones in pregnancy. So, the overview and purpose is for you to be able to understand how the hormones in your body are helping to sustain your pregnancy and also how the hormones in your body could be potentially affecting your mood and how to find balance. Because for a lot of times we hear, oh, it's just the hormones. Oh, blame it on the hormones. I'm tired, or I'm crying, or I'm hungry, or I'm irritable. Just blame it on the hormones. But when we understand how hormones regulate and sustain your pregnancy and just your overall body, whether you're pregnant or not, it helps to normalize the changes that you inevitably feel. So before we go further, I want to ask, or I want you to think about a question. How has your body changed during pregnancy? So I'm going to pause the recording real quick and we're going to talk a little bit. How has it? Oh, we're going to keep it pushing. So thank you all for sharing the ways in which your body has changed throughout your pregnancy and continues to change up until it's time for you to deliver your baby. But when we think about the way that hormones play a role, thinking about it like how we would say, okay, knowing when your cycle's coming and being like, okay, I'm crampy. This is what I'm going through. Okay, I know what to expect, right? We get to experience that, I don't know, let's just say 100 times before getting pregnant. And then we get pregnant, our body is thrown into a whole nother hormonal cycle and a whole nother shift. So when we think about the hormones that are at play when you're pregnant, when you confirm pregnancy, up until it's time for you to, have your baby, and even when you start lactating, these are the five main hormones. So we have HCG, and we're going to call it that for short, but it's really human chorionic gonadotropin, long name for the stuff that helps you grow baby. Okay. So when you take a pregnancy test, this is what it's testing in your urine. It's testing a certain level of HCG that would be present to say that you are pregnant. For most women, we don't have this hormone in our body before we get pregnant. So any little bit of HCG is going to say you're pregnant, but as your pregnancy grows, you will have a higher level of HCG until about the end of the first trimester into the second, and then it kind of levels out until your baby's born. But by then, after the first trimester, most of us know that we're pregnant. We've already done the pregnancy test. And when we think about that steady rise until you get to like the end of the first trimester, this is when mamas are experiencing the nausea, the vomiting, the feeling like they're going to like a dry heave. It's all because of the HCG. So if you experience those things, the nausea, the vomiting, you can blame this hormone. And the second one is the human placental lactogen. So this one, HPL, is what is, it's also known as the human chorionic somatotropin. But when we think about it, the name of human placental lactogen just tells you that it's made by the placenta. And what it's doing is it's giving the placenta is giving your baby nutrients, and then the hormone stimulates your milk glands to prepare your body for breastfeeding. So once mamas get to about that 12 to 14 mark, like right around with that HCG, it peaks and your body is already producing milk for your baby. So all of you already have milk ready. It's just waiting to be stimulated for once baby arrives. The third hormone is called estrogen, and it's found in the ovaries. But when you're pregnant, it also is made by the placenta. So this is where a lot of times mamas are like, oh, I just feel really, I just feel really, up and down as far as like, emotions. This is where the estrogen can peak and your skin looks really good. Everybody's saying you're glowing. We can thank estrogen for that. And then progesterone is made by the ovaries as well and the placenta during pregnancy. And this is what's present in the early stages of pregnancy that helps to thicken the uterine lining and allow for that egg to be implanted and stay implanted. So before the placenta fully develops, progesterone is making that lining really, really thick so that fertilized egg can be sustained until the placenta grows. And then finally, we have prolactin. It's the main hormone that is needed to trigger the release of the milk that is already in your body. So when we think about prolactin in that respect, it has other roles that aren't related to milk production. So it contributes to the development of your baby's lungs and their brain, and it also helps the mom tolerate the fetus. So when we think about it like that, prolactin is one of those hormones that before you're before you deliver your baby, it's doing all this work. And then after, it's supporting with that release of the milk. Okay. And then when we think about like tolerating the fetus, a lot of mamas are like, well, what does that mean? Our bodies and our immune system is designed to protect, attack, and defend. Okay, so the protection is when we, have a good health and good eating habits, and we have a good gut lining, right? That's protecting our body and our immune system to build it up. When we think about attack, it's when we're sick, right? And we're like, trying to bring more white blood cells, or we're trying to fight off an infection, and we're doing, the vitamin C, and we're doing the elderberry and all that. That's the defense, or excuse me, that's the attack. And then when we think about defend, when you're pregnant, your body and your immune system has to yield, because now you're building a baby. And for a lot of moms, their immune system, for all of us, our immune system wants to attack the baby and be like, hold on, who is this? What is this? This blood type is different. What is this thing growing? And that prolactin helps to relax the mom's immune system so that the baby can continue to grow without your body doing what it wants to do, which is defend itself and say, no, 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 this isn't supposed to be here. Okay. So, are there any questions about these hormones before we dive into a little bit more about their role and how they can affect our bodies? And if so, I will pause the recording so we can chat about it a little bit. Give me a thumbs up if we good to go. Awesome. Okie dokie. So, all right. So let's go back one more. Okay, here we go. So, stress during pregnancy. So this is where we are thinking about stress that is beyond what is normal, right? So feeling stress is common, but too much can make you feel uncomfortable, and it can also make it difficult for you to sleep. You may have headaches, you might lose your appetite, or you might overeat. And when we think about high levels of stress, the hormone cortisol is triggered in our body every time we're stressed out. When we are, we could be driving in LA, or we could be driving on the freeway and be in traffic and be like, oh my God, like this is so stressful. What's going on? These people are cutting me off. Cortisol is being released. And it's okay, because it's normal for our body to do that. But during pregnancy, if you have a lot of stress in your life and you're dealing with high stress situations, a lot of that over time can cause issues with baby, and then also long-term health issues for you, like high blood pressure and heart disease. So when we think about how cortisol plays a role in pregnancy, our body needs all of these hormones. Let me go back a slide. Hold on one second. I'm gonna go back. Our body needs all these hormones working in conjunction with each other. It needs the space to have, the prolactin and the progesterone and all of that. But what cortisol does, cortisol tells our body to hold on to what it needs and let go of what it doesn't. And just like we talked about with prolactin and how it helps to depress depress your immune system so your body isn't trying to attack baby, cortisol does the opposite. So cortisol heightens our immune system and says, hey, 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 we need to fight or fly. We need to figure out what's going on. And cortisol and that fight or flight hormone, the adrenaline and the norepinephrine, those two work hand in hand to cause these health problems if we're having them over a long period of time. So little spurts of moments where you gotta, catch something or get somewhere safe or swerve in your car, that's okay. But if you're having stress at your job, and then stress when you're going to the doctor, and then stress with your relationships, this is where we start to see how cortisol affects babies and pregnancies. And what it looks like is low birth weight babies, preterm babies, moms that end up developing high blood pressure during pregnancy, or even gestational diabetes, because their body is holding on to a lot, and that hormone is contributing to it. So, when we think about ways to relax hormones naturally, do your best to eat real food, so minimally processed food. And one of the biggest things that I tell moms, and TT and Portia, you're gonna hear me tell you this, so just go ahead and get ready. Get enough protein. Like, and I'm when I say get enough protein, like we need to be thinking that protein is building your baby, it's helping you have energy, and it's also helping to prevent your body from digging into the nutrient and mineral stores that it has to keep you alive to now feed baby. So when we're thinking about how much protein you should be getting, hopefully saying at that 100 grams per day, but at least 70 to 100. And what that looks like is instead of having 2 eggs in the morning, have 3. Instead of having a little chicken breast, have 2 chicken breasts. Instead of eating 1 piece of fish, have 2. Instead of having a big bowl of rice with your meal, cut that carb in half, have some more protein and some veggies. Okay. Staying hydrated, focus on vegetables that have some sort of leaves on them. That's what cruciferous means. Leafy vegetables, green vegetables like broccoli, Brussels sprouts, kale, collard greens. What else? All of the things that we think of and we say, okay, I'm gonna eat it, but then we have this tiny portion. Increase that portion size of the green vegetables and the protein. And number 5 is really important because when we think about limiting our exposure to things that can disrupt our hormonal system, which is the endocrine system, we're thinking about things that are like synthetic estrogens and progesterones. So a lot of times people are like, well, what is that? And how does that mess with my body? Now, if we are if we're getting our nails done, if we're getting our hair done, if we're getting our hair dyed, if we're getting our hair relaxed, these are all ways in which these endocrine disrupting chemicals can come in contact with our skin and be absorbed into our bloodstream. Also, if you're using Fabuloso, if you're using any of those really strong smelling cleaning supplies to disinfect and clean your house, these are also ways that these chemicals can get into your bloodstream and be absorbed, whether you are inhaling the smell or whether you are using your hands instead of putting on gloves to scrub or to wipe things down with the products. So just thinking about how that can impact your body, because we want those hormones to flow freely and we want you to not be at a too much hormone or not enough. And our body is doing this and releasing these hormones in a balanced way. So we have to be very just aware. I don't want you to be like, oh my God, I use this and I use that and I use that, but just being aware of when you are cleaning, open the windows so none of the smells are staying in your house, and just moving through it with a little bit more intention and awareness as you are continuing to grow your babies. Of course, number 6, limit your alcohol consumption. This is something that I would tell you if you weren't pregnant, but especially being pregnant. And then also, this one's really important during postpartum. We want to ensure that we are limiting our alcohol intake, mainly because alcohol disrupts our hormonal release of progesterone. So we want to make sure that we are giving our body that space and opportunity to continue to make the hormones it needs to help us heal, to help us produce milk, and to keep things in balance, especially in that postpartum period. And of course, take probiotics to protect your gut health, replete deficient nutrients. So if you're calcium deficient, or you're vitamin D deficient, or you're iron deficient, take those supplements. Make sure that you are staying hydrated so that you won't get, constipated. And then number 9 is poop and sweat daily. So I am always going to talk about poop. So prepare yourself, because being able to be regular while you are pregnant is a blessing. And a lot of mamas' digestive system changes as a result of the hormones. And we're going to talk about a couple more hormones here in a moment that really impact how our body digests and the way things are moving and how they affect our overall wellness. Because all the things that you all mentioned about feeling loose and feeling like you can't stretch because things are tight, and you need to stretch, but it's hard because there's just this extra weight and fluid and having to move slower and feeling frustrated. These are all based in that hormone that we're going to discuss shortly. Okay, so now we talked a little bit about the hormones that are helping you sustain your pregnancy. Now we're going to talk about the physiology of pregnancy. So we're going to combine the hormones that we just learned about with a few more and think about how they're impacting what you all said as far as how you feel physically in your body while you're pregnant. So your objectives are recognizing the skeletal structures that support pregnancy, understanding the common issues people experience during pregnancy, and assess potential remedies to alleviate discomfort. Like, we're not about to talk about all this, and then y'all like, okay, well, what am I supposed to do about it? We're going to talk about it. So this hormone is the one I was talking about. So the musculoskeletal effects of pregnancy. Around 8 weeks, your body starts to release relaxin, which is a hormone designed to relax the ligaments in your body, especially the pelvis and your feet. So when one of you mentioned, everything just feels loose, I can't get up and move and react as quickly as I would, blame relaxin. Relaxin is the reason why you feel loosey goosey. Okay. Now it's beneficial because it helps those ligaments to just ease and kind of yield as baby continues to grow. The presence of relaxin in your body affects your spine and your pelvic alignment. So, which is the direct cause of your back and your pelvic pain. So for some moms, you're like, oh, I got this pubic symphysis disorder and I got, all this stuff going on. I got sciatic pain. Blame relaxin, because that sciatic nerve runs right past your butt cheek. And when you have that relaxin opening your pelvis, it's compressing that space where that nerve lies, and then you're like in pain or you're uncomfortable and you got to have a pillow and you got to have a lift and you got to have all the things when you're sleeping. So just understand that what you're feeling is normal. And now that you know more about the hormones present, you can just be walking around in the house like, oh, blaming the relaxing. I'm chilling today. I'm not doing nothing because I feel uneasy or I feel unaligned, and it's impacting your balance. The abdominal muscles cannot be ignored when you're considering their role in development of back pain. So as your abdominal muscles open, so basically your abdominal muscles are going from being like, they're going from being stitched together like this to now this part where my thumbs is moving. And then as your belly continues to grow, then it's opening up. So they're literally separating. And that space between them and the strength of your core is being impacted. So if your core is being opened and stretched, then guess what's going to have to take the burden and also be uncomfortable? Your back and your spine, because this front part and the back part, they play a role in stabilizing your body, and they do that together. So it's normal to lose core strength because the volume and the weight of your growing uterus, but it can also place stress on your abdominal wall. It's placing stress on your abdominal wall to support your baby. So this is where you hear people say, don't do jackknife exercises, which is basically like, no crunches, no rising up out of bed like a vampire, all these things, because when we do those, we're adding more strain to our abdominal muscles, and we don't want to do that when we're pregnant. Pregnancy safe exercises would be like leg lifts or like going for walks, doing light yoga, but nothing on your back. Those are things that would be able to support engaging your abdominal wall, but not actually doing something where the weight of baby is on your back and now you're trying to squeeze your core in. So, like I mentioned before, light exercise and walking is a great way to increase your mobility and relieve discomfort. Now, this is where we talk about, okay, counterintuitive things. If you're uncomfortable and you don't feel good in your body, I'm just going to lay around because I'm not comfortable. But when we're pregnant, our body needs to release hormones, and it needs that lubrication of walking and movement. So if you are being told don't work out, we're not saying stop doing activity. We're just saying stop doing load bearing activity. We're just saying go for walks instead of running, or do, your body weight exercises instead of lifting weights. Because as your body continues to grow, you need to stretch those muscles. You need to relieve that discomfort. And one of the best ways to do it is going for walks. It doesn't have to be 2-3 miles. It can literally be a mile a day. And that shouldn't take you more than 45 minutes to walk a mile. And it's not a long pace, it's not a high pace. We're not doing like they do at the mall, the ladies that get up and do the speed walking. We're just doing a light 30, 45-minute walk where you can stop, take a break, drink some water, and keep going. Are there any questions about relaxing and how it impacts your muscles and your skeletal system? Okay, good. So, this is what's going on inside of your body while you are growing your baby. So on the left side, this is a non-pregnant female body. So they basically imagine if they took a picture of us from the inside and they just sliced us down the middle and opened us up. This is the right side of our body. So all of those organs, your liver, your stomach, your pancreas, your colon, all of them got a lot of space before being pregnant, right? They got all this space here. There's a lot of green space here, which shows you that that's just like your body cavity, right? There's nothing there. Your uterus is small, chilling right behind your pubic bone. And then your bladder's here, your rectum and your anus is here. Everything's good, right? Everything's where it should be. And the spine is something that I want you to look at. Our spine has that natural curve at the bottom, and it's nice and elongated at the top, right? Now, when we're pregnant, over here on this right-hand side, let's see, where's my cursor? Here we go. This right here, this is what we're dealing with. This little human taking up all of that green space and compressing your intestines up against your stomach, up against your pancreas. The bladder is pressed down. The rectum literally has a little human's head pressing on the top of it. All of this work to build this human, and it's literally taking up all the space that you have inside of your body as they grow. And when we think about this area here with our spine, do you see how much more strain, if we look at these muscles here on the outside, right here, it's literally pulling on those muscles that connect down to like the back of your pelvis. So when we are thinking about that, and we're thinking about, oh, why am I so uncomfortable? It's because those muscles are stretching. The space between your vertebra is getting more stretched. And then all of these organs that used to have space, they don't have no more space. They are literally squished up in your chest. We can't even see your diaphragm in this second picture because it is literally under your boobs to the point where it feels like you're short of breath. It's hard to take those deep inhales because everything is being pressed up toward your heart instead of being in its natural place. So this is why you get short of breath. This is why your back hurts. This is why everything feels misaligned, because this little human, this little bun that you're growing is getting bigger and bigger every day. And as they continue to grow and kick and shift, all of these body systems, especially our intestines, they are being compressed. And now, instead of them being close to down here where your rectum is, now it's got to travel a lot further to get the poop to come out. Okay. So this is where our poop conversation continues. Relaxing, which we were just talking about, is relaxing the smooth muscle as well. So it's not just relaxing the ligaments, it's also relaxing smooth muscle, and it's slowing down. It's making your stomach and your intestines and your digestive system slow down so that it can absorb all the nutrients. And that's one of the reasons why a lot of moms experience constipation when they're pregnant, because their body is literally slowly moving the poop so that it can absorb as much as it can to give to baby and give to you. So one of the things that you can do that will help that and that will alleviate that constipation if you are experiencing it is going to be having warm water with maybe a little bit of lemon and ginger in the morning to help get things moving. And then also you can take magnesium, and then if magnesium doesn't work, then it can be like a stool softener to support you with it, because that's going to help to relax your body enough to get the poop down, and then drinking the water is going to help to soften it and continue its movement and voiding out of your body. So as we think about all of this, one of the things that I want to help you all and that we can practice is a good posture and alignment to prevent any of this low back pain that you already have now becoming an issue in postpartum. So, one of the reasons why we talk about this so much is because when we're pregnant, of course, in the picture, everything's pushed forward. So then we got to lean back to stay balanced, right? So we're doing this constant teetering forward and back to try to find alignment. And that S curve that's at the bottom gets more and more deep. That curve gets deeper. Now, once baby comes, that weight is gone, but now we got to hold the baby. And now we got to burp the baby. And now we got to feed the baby. So we go from having this hyper extension where things are just back and we're just walking and that curve is really deep, to now we got to lean to it, right? So some of the things that we can start doing now while you're pregnant is going to be cat and cows. So who knows what that is? And I'm going to still explain it, but I need to know kind of like how deep to go. Do we know what cat and cow movements are?
I think I do. I think it's like when you arch your back, right? Or like you arch your back and then it then flex it back kind of. I don't know. It's hard to explain, but
Yeah.
I'm thinking of.
All right. So when we think about alignment, this is one of the main things that we want to be aware of, because in postpartum, you got a whole nother set of desires and concerns. Okay. So it's like you go from saying, okay, well, I'm just growing this baby, to now, dang, I gotta like take care of it and do all these things. So just practicing this now will help you in postpartum, because you'll have something to pull from. Oh, I got some back pain. Let me do some cat cows. Um, and then it's also a great way to prepare for labor, getting your body in different positions, breathing through those positions, and being able to release tension is always going to be helpful. So, some natural ways to prepare for labor is work with gravity, stay off your back. So this is where you hear them say, after your first trimester, you can't be on your back anymore. It's less about how uncomfortable it is as far as the weight of baby, and more about the fact that yes, the weight of baby can compress your blood vessels that gives oxygenated blood to baby, but it also can shift the position. So even if we're like laying on the couch and we just recline back just for a moment, or we're in bed and we wake up on our back, 9 times out of 10 your baby's fine, but they also could be moving around and go from being in a head down position to now in a breech position, where that means their booty is down, or they're just not optimally aligned for labor. A second thing you can do is move your hips and shake your booty. So this is the one time you get permission, if you ever needed it, to dance and twerk. Like, I've seen moms do it. They're like, oh, I just want to move my hips in circles. Like, girl, move your hips in circles. Get you a birth ball, or even one of those little like rocking chairs. Like, I'm sitting in one now. It's like a backless rocking chair, and you can rock back and forth and use your hips and just roll back and forth. And if you like to dance, doing dances that help you do that same spinal alignment of like poking your booty out, bringing it in. So that's where we get, twerk your baby out. You can totally do that. Lengthening your spine. That's hold on one second. Let me pause it. Go ahead. So if you are the type of person who likes to sit and like Indian style, like crisscross, then your baby will more than likely be in that head down position, chilling, because there's space, because you're making that space seated with your legs open. If you like to recline back in chairs, the best thing is what you mentioned, is putting those pillows behind you so you can still recline back, but you're not flat and just chilling. Because when we go flat, baby interprets that. If we go back, let's go back to this picture. Baby interprets that as, okay, we chilling. I'm about to turn and lay like she laying, right? And then that's how we end up with a baby who's not in this position. This is the optimal position for a baby to be born, where their face is toward your spine and they are head down. Okay. Now, when we lay, if we lay back and reclined all the time, baby still may stay head down, but they're going to go from facing your spine to facing your belly button. Or they might go from being head down to now being like transverse, where their head is, instead of your belly looking around like this, it goes around like on the outside. So just thinking about that and being more cautious is going to be helpful for you when it's time to deliver. So other natural ways to prepare for labor: do exercises that release tension. So yoga, stretching, breath work, all of those things will help. And when we're breathing, we want to take deep inhales through our nose, fill all the way up as much as you can, right? Because you're pregnant and those lungs are being compressed by all your other organs shifting up. And then exhale out through your mouth. So open your mouth, blow the air out. So let's practice that. We're going to take a deep inhale, and we're going to exhale. Another inhale, and then exhale. And when we do those breaths, that helps to create pressure on the inhale, and then the exhale is releasing the tension.